Hi, today I'm going to be talking about type 2 diabetes, a chronic illness that affects millions of people around the world. I'm going to explain the disease, I'm going to explain some of the risk factors, the progression, prognosis, and some available resources, and how I would support someone that I loved that had type 2 diabetes. So, what is type 2 diabetes? Type 2 diabetes is a chronic illness in which the body becomes resistant to insulin or it does not produce enough insulin to regulate the blood sugar levels that are normal for a person. So what is insulin? Insulin is a hormone that is created by the pancreas that helps put glucose into cells for energy use. However, when insulin does not work properly or the body becomes resistant to it, that leads to a buildup of glucose in the bloodstream, which ultimately leads to high blood sugar levels. There are a lot of factors that can increase a person's risk of developing type 2 diabetes. Some of these include being obese or being overweight, lack of physical activity, indulging in a lot of sugary foods or unhealthy fast food items, poor diet, family history of diabetes, age, especially if you're over 45 years old, high blood pressure, high cholesterol levels, smoking, and yeah, those are some of the risk factors that can increase your chances of developing type 2 diabetes. So for the course of diabetes and how it progresses, it's generally a very slow progressing disease. And it can first start off by a resistance to insulin, which causes the blood sugar levels to be elevated, but not quite enough to get the diagnosis of type 2 diabetes. And without lifestyle changes or treatment, this can turn from pre-diabetes into actual diabetes as the blood sugar levels increase over time. And when it's uncontrolled and not treated after already developing into type 2 diabetes, it can damage the nerves and blood vessels, which can lead to complications such as heart disease, stroke, kidney disease, vision loss, nerve damage, and poor wound healing. So it's very important to get medication in order for this disease to stay slow progressing and not get any high risks of complications. Further into this and the prognosis of type 2 diabetes, it's generally a very well managed disease, and a lot of people can live very long, healthy lives living with type 2 diabetes as long as they manage well by taking medications as prescribed, eating healthy foods with a good diet, getting regular exercise, and monitoring their blood sugar levels, and as well as attending regular medical appointments to manage their type 2 diabetes. So, however, poorly controlled diabetes can significantly shorten the lifespan of those who have it, just because of all of the complication risks that I talked about earlier. So I researched some available resources for those who have diabetes type 2, and I found first of all, the American Diabetes Association, which is a site that has a lot of educational materials for those with type 2 diabetes, some meal planning guides, support programs, and some other diabetes management tools. So that's a really good resource. And my second resource that I found was the Centers for Disease Control and Prevention Diabetes program, which also offers more information on prevention, treatment, and lifestyle management for those with diabetes. And third, I found the Health First Diabetes Education program, which is a more local diabetes website for around my city in Brevard County, Florida. And again, it just provides some diabetes education and support services for those patients who have it to help them be informed and know how to manage their lifestyle. My loved one who has type 2 diabetes is my grandmother. She is 68 years old. For her lifestyle, I would say that she is a pretty homebody person. She spends a lot of her time at home because she's retired. She likes watching television and reading books, but she does not exercise regularly or as much as she should. She often eats a lot of convenience foods, high sugary foods, just for convenience and just to get something fast. And although she occasionally walks around her neighborhood, I would say she spends most of her day sitting down in a chair watching TV. She though also does have a very strong social support system with her family and her church, and they visit frequently and help her with a lot of her daily living activities. Now, going into her medical adherence, I would say that she does care about her health and takes her medications regularly most of the time, but she has been known to miss some of her medicational doses sometimes. But she does understand how important it is to take her medication for diabetes, which makes me think that I think she would be willing to take some steps to increase her her steps to increase her. Oh, pause. But because she does care about her health and wants to remain independent, I think she would be very willing to take some steps to improve her treatment and quality of life to better her type 2 diabetes. So I would say her social support includes her children, her grandchildren, her friends from church, and her healthcare team and her primary care physician. So with all the help of these people to help her stay motivated and manage her lifestyle, I think those would help her a lot. So I thought about a few ways that I could help her to manage her lifestyle and manage her diagnosis. And the things that I came up with were, first of all, accompanying her to her doctor's appointment and helping her to understand any of the medical treatments they recommend for her, and just helping her understand what the doctor is saying. I would say another thing that I thought about was helping her to organize her treatments and maybe like a pill weekly organizer, just so that she knows exactly what to take, when to take it, because I think that helps a lot, would help her a lot with missing doses, because it's a lot to remember. I would encourage her to regularly test her blood sugar, because that's another thing for type 2 diabetes that people miss out on a lot, is just regulating their blood sugar levels and making sure that they're staying where they should be at. Another thing I would do is to encourage her to take more walks, maybe by asking her to go with me to take these walks, because I think that would help her to increase her activity level a lot. And also, just lastly, calling on her and to check on how she feels and making sure that everything is okay with her life and her body, because I think it's important to, I think her as a person, she doesn't reach out a lot whenever she's struggling. So I think by calling her, that would help a lot with helping her condition. So yeah.